Hello, my name is Sally Hull and I'm a GP based at the Clinical Effectiveness Group at Queen Mary University. This video is about an asthma quality improvement project in Newham. It'll start in April and run for 2 years. Both the CCG and the local GP respiratory lead are supporting it. The project aim is to reduce asthma admissions. And by the end of this video, I hope that you'll understand the problem and see how the new asthma tools in EMIS Web can help you reduce severe asthma attacks. Asthma still kills people, and in the UK, over 1,000 people every year die with their asthma. It's estimated that about 2/3 of these could be prevented. It's also the case that in East London, there are more hospital admissions for asthma than in the rest of London or the rest of the UK. For asthma patients who take regular inhaled corticosteroids, the more SABA or salbutamol they are prescribed, the more likely it is they will have a hospital admission. Local CEG searches show that more than 5% of people with asthma are prescribed 12 or more SABA inhalers in the previous year. So how can we reduce this? Well, we have shown that electronic prescribing alerts can actually prevent excessive SABA prescribing, and Jim here is going to tell you more about this.
Hello, I'm Jim Cole, a GP in East London and at the Clinical Effectiveness Group. I'm going to take you through the two tools that we've developed. Firstly, a clinician-facing on-screen prompt in EMIS Web to alert you to patients who are overusing salbutamol, and secondly, an asthma prescribing tool that you can use in your practice admin office. The EMIS Web Alerts will be active in all practices in Newham from April 2020. They are similar to the methotrexate prescribing alerts you may well be familiar with. When a patient who is overusing salbutamol has their medical record open, you'll be presented with the alert and 5 options. You may be able to complete an asthma review at that time, but you may want to invite them back for an asthma review at a later date, either by letter or by SMS text message. There is of course the option to do nothing of that at that time, and clinicians can deactivate the alert permanently if that's appropriate. And don't worry, the alerts will only activate once per day. The second resource is the asthma prescribing tool, which is similar to the other tools released by the CEG. The idea is that you'll create a list of patients who might most benefit from an early asthma review. There are 2 steps that you'll need to complete. Firstly, run the search, which can be found in the Real Health section of the EMIS Web CEG area. You'll then need to import the results into the asthma prescribing tool Excel file. Step-by-step instructions can be found on the CEG website. Once you've run the tool, you'll be presented with a list of patients, and you can filter the list according to numbers of salbutamol prescriptions and numbers of inhaled steroid prescriptions. We suggest you run this tool quarterly. We've written a brief guideline to support clinicians through the asthma review process, and this can also be found on the CEG website. You may need to consider starting or stepping up inhaled corticosteroids for those patients who are overusing salbutamol, and those already taking high doses of ICS may need to be referred to secondary care. The CEG EMIS template now features more resources for patients, including links to our leaflet, How Do I Look After My Asthma? That's in addition to links to smartphone apps, videos to improve inhaler technique, Asthma UK resources and local group activities. Links to these resources can be sent via text message using the Accurate system.
During the 2-year project, an Asthma Dashboard will show the number of patients that each practice has who are prescribed more than 12 SABAs in a year. Hopefully that's going to be going down. It'll also show the number of asthma reviews done and the educational resources given to patients. Thank you for watching, and you can get more information from the CEG website or from your facilitator.